My pleasure to be here. I'm really excited to be talking to a different group than I usually talk to. Usually it's a bunch of people on the human health side, and so I think it's going to be a really interesting discussion. I don't think I have enough slides to fill the whole session because I wanted to leave some time for questions. Hopefully we'll be able to start a discussion going. As Steve mentioned, I'm on the human health side, and I'm in the division called the Division of Healthcare Quality Promotion. And what that is the division focused on healthcare delivery and how to improve healthcare delivery, make it safer. A lot of the division is focused domestically. You heard from Dr. Laurie Hicks and Dr. Arjun Srinivasan yesterday. They're both in my division. They both work on the human health side aspects of it, especially around stewardship. I'm a little different because I work on the international side. So I take some of the lessons learned from the domestic side and try to apply some of these important lessons learned outside of our borders. And that's very challenging, as I'll hopefully try to touch on, because the challenges that we face internationally are there's similar themes, but the reality is quite different. Obviously, we're dealing with a lot of situations where resources are limited, and we don't have quite the same capacity to respond as we do in the United States. So some of the solutions are a little bit different, I think. As Steve mentioned, I'm the head of the International Infection Control Program, and what we do is primarily work on sustainable solutions in healthcare facilities to try to prevent transmission of diseases within the facility, as well as the development of those, and I'll be talking about that in a little bit. So this is a pretty famous slide. It's kind of, a lot of people have seen it, at least around CDC. I don't know if a lot of you have seen it, but this is a slide showing, essentially travel, global travel in the world, and highlighting some of the popular routes. And a lot of you probably got here by plane or train or automobile, but just showing that we're all interconnected. This is a really global problem of antimicrobial resistance, and problems that develop internationally are just a plane ride away from coming into our borders. This is one of the reasons why we need to be focused on this. And this is really highlighted, I think, with a recent WHO report that came out in 2014 talking about global antimicrobial resistance and how it's reached alarming levels in many parts of the world. They found high levels of resistance in all the WHO regions, as well as demonstrating that the treatment options are limited and becoming more limited. Just as a kind of a timeline of the development of the different types of antibiotics, I think a lot of people know this, where now we're in a little bit of a discovery void where there aren't as many new antibiotics in the pipeline. Well, I think importantly, one of the important things that this report showed was that there are a lot of gaps in surveillance, as well as around data sharing and coordination, highlighting, I think, the need to coordinate more closely to be able to understand really what are the problems. I think that's actually part of the issue, is that we don't have a very good firm grasp on the scope and magnitude of antimicrobial resistance outside of a few countries. I think we've done a great job in the United States describing that problem, but for many areas in the country, there is limited capacity to detect antimicrobial resistance in laboratories, and there's even worse capacity to coordinate and report these data. So these are one of the main challenges I'll be talking about how we're trying to accomplish this task. Well, what we do know about antibacterial resistance is that it is a problem, and it's probably a worse problem in the developing world. Data from the European Union, and this is a WHO slide that shows that data from the European Union estimate, around European Union with a population of 500 million, United States with a population of about 300 million, about 20 to 30,000 deaths per year related to antibacterial resistance. But one example, Thailand, a population of only 70 million, over 38,000 deaths. As well as prolonged hospital stays and a heavy burden of societal costs, up to $200 million in direct costs compared to, for that population, which is a large amount, especially given that economy. So I think that what this slide is trying to convey is that while the problems in the United States and Europe are large, proportionally speaking, relative to the size of the economy and the size of the populations, in the developing world they may be larger, but we need to have more data to really affirm this. So, as I mentioned, I'm the head of the International Infection Control Team, and I'm going to talk a little bit about infection control. I think many of you on the kind of animal side probably can understand why infection control is important, but it's really important in the healthcare facilities. I think a lot of people here clearly understand that the development of antimicrobial resistance has been in large part due to unnecessary antibiotic exposure in healthcare settings, both outpatient and inpatient, as well as, I'm not an expert on the veterinary side, but so I won't really discuss that. But it's clearly on the human health side, overexposure to antibiotic use is a key problem. And transmission of antimicrobial resistance does primarily occur in healthcare settings. And this is a lot due to poor hygiene and lack of transmission precautions. So what that means essentially is that in healthcare facilities, things like lack of running water, things like lack of personal protective equipment, and the inability to wash your hands and disinfect environmental surfaces can sometimes lead to transmission of antimicrobial resistance. So while the development on the one hand is clearly an issue, the transmission is also a big issue. And when you tackle this problem, it's important to think about both sides of the equation, not only the development side, but also the transmission side. Because while you can do a lot to work on preventing it to happen in the first place, you should probably also work on preventing the transmission of that from person to person, from people to environment, and from environment to people. So to reduce the burden of antimicrobial resistance, infection control in healthcare settings certainly must be a focus. And I don't think I have to really go that far for you all to kind of to demonstrate why, especially in the media, it's been played out to be an importance for infection control. So, if you go all the way back to 2003, you'll remember the SARS epidemic, and I remember that quite vividly. I worked on that. I was a kind of a young EIS officer in CDC working on the SARS epidemic, and one of the things that was one of the hallmarks of that epidemic, as you'll kind of remember, was the problems that they had in hospitals, where whole hospitals were having massive problems with these super spreading events where people would become, infections would spread within the hospitals. Healthcare workers were getting sick. People were getting sick. Clearly, the Ebola outbreak, that was also a big problem. And not just in the, when you think about Ebola, you think about the Ebola treatment units where you have the people in head-to-toe PPE and they're providing care to the patients. What I think was a little bit lost in the media was actually the riskiest areas for the Ebola epidemic were in the hospitals that were not the Ebola treatment units. So these were in the general hospitals and the general clinics, because clearly patients with Ebola, the first place they go is to their local clinic because they're not feeling well. They don't know that they have Ebola necessarily. And without infection control measures in those facilities, what happened was that a lot of those healthcare workers became ill because they honestly didn't have the supplies or the knowledge to be able to protect themselves. And then even more recently in South Korea, we saw, essentially the entire economy shut down for a couple days to a couple weeks in Seoul, which was a major issue. It didn't get, I think, as much recognition here, but I'm Korean American and my parents live in Seoul, and they were, every day I'd be on the phone with them just talking about how because of this problem in the South Korean hospitals, basically people were afraid to go to the hospitals in the first place, so that led to a lot of ripple effects downstream from access to health care. All right, well, that's a lot about kind of some of the problems. I talked about infection control. I talked about some of the issues around antimicrobial resistance. And I actually want to talk a little bit more today about the global health security agenda, because I think that's part of the solution. So I'll talk about that also a little bit. So one of the issues around that I think I touched on with the WHO report was that we don't have enough data about what the problems are. And this is going to be a key component moving forward in some of the CDC activities, partnering with countries, is to acquire, not to acquire, but to help countries understand what their own data, their own burden of resistance is. Oftentimes we develop data in a void, and what we don't want to have happen is that happens again. What we want is for the data to inform action. So not only should the data help to demonstrate the burden and magnitude of the problem, but it also should help to inform the action about where we should focus our efforts. So just in general, I think maybe you have heard about this a little bit, but in general our strategy is kind of, you could break it up into 4 different buckets, and this applies to the international arena as well. Basically, detection is important, trying to track antimicrobial resistance, as well as uncover outbreaks quickly. I think one thing we talk about a lot is that, well, once we start looking for it, we're going to see a lot of it. And we're going to find things like outbreaks. We're going to find CRE in hospitals that are spreading through neonatal intensive care units or through hospitals. We're going to find a lot of issues. So we need to respond. And that's the other part of this. We need to help ministries of health in these different countries be able to respond to these outbreaks, because we're going to find them, I think. Also important is the prevention. I talked a little bit about how important it is to prevent transmission through infection control, but also helping to be a part of the solution in regards to stewardship, in regards to antimicrobial use, and how we can help countries understand their own data, understand their own burden. I think a lot of people may or may not know, but we're in a special situation in the United States and Europe where you need to have a prescription to get an antibiotic. But if you go to many parts outside the United States, that's not the case. You can get very powerful antibiotics just by walking up to outpatient pharmacies, and there's really no oversight by a clinician to help educate the patients around, making sure you take the antibiotic for the complete course. So there's a lot that needs to be done as far as the antibiotic side in international settings. And clearly that's a big problem that's leading to some of the resistance development. And obviously innovation is a huge area as well that many different parts of the U.S. government are helping on. So I think that you've probably heard about the Carb, the Combating Antibacterial Resistance, Antibacterial-Resistant Bacteria strategy through the White House. But what's important in the Carb is that there's actually a part for international work. So one of the main goals of the Carb and objectives is to improve international collaboration and capacity for prevention, surveillance control, as well as research and development. So I'm going to talk a little bit about what that looks like through the Global Health Security Agenda. Well, the Global Health Security Agenda is a major policy initiative through the White House, but that touches on many different aspects of the United States government to work on global health security. And so one way to think about it, President Obama said that we must come together to prevent, detect, and fight every kind of biological danger, whether a pandemic like H1N1, a terrorist threat, or a treatable disease. And this includes antimicrobial resistance. So this has been going on for a while, but I'll just highlight what's happened recently. It was launched in February of 2014. There have been a number of high-level meetings over the course of, essentially over the year. And what happened last March of 2015 was that the priority countries were selected. So what's important about the Global Health Security Agenda is that we're not trying to tackle all of these problems in the entire world. We're focusing on a few different countries through what we call a twinning framework, where essentially the United States is working as a twin with another country, and we're working to help them come up with their own solutions. And you can divide the Global Health Security Agenda into three big buckets. Really, it's kind of along the lines of prevent, detect, and respond. Prevent avoidable catastrophes, detect threats early, and respond rapidly and effectively to global health threats. And I'll talk about this. So in each of these three different lanes, there are all these what we call action packages. So what this really means is these are just areas of focus for the government, for the U.S. government, for internationally, because this is not one thing that's important to notice is that this is not a U.S. government led effort. It's a multinational effort, and many different countries are taking part in all of the same action packages. So, for example, while the United States is working on these 12 action packages with many different countries in Europe, in Asia, and South America, they're taking it upon themselves to achieve these targets within their own country, as well as working with other countries. So I'm going to talk about how we're trying to achieve these 12 different action packages by giving assistance to other countries. So as you'll see, there are a lot of different things here in these action packages, everything from helping to build laboratory systems, helping to build emergency operation centers, helping with surveillance, working on zoonotic diseases, biosafety, biosecurity, but the thing that I think we're all most interested in here is antimicrobial resistance as being one of the key action packages around global health security. So just to go in a little bit more about this action package, this is, the 5-year target is really to implement a global package of activities to combat AMR, and you can kind of break it down into its main components of enhancing infection prevention and control. I talked about why that's needed to prevent transmission. Prevent the emergence and spread of AMR, especially among the drug-resistant bacteria. So these are things like helping to work on stewardship programs on the human health side, work with ministries of agriculture to help understand the areas around antibiotic use. But most importantly, probably, is strengthen the surveillance and laboratory capacity needed to detect and monitor the antibacterial resistance. As I mentioned, this is a key component of the WHO's plan, and it's a key component of global health security. So what are the countries? As I mentioned, we're not trying to do this everywhere. The U.S. government is focusing on a few countries initially because it's pretty much impossible to do it everywhere. But these are the phase 1 countries that have been named. As you can see, they're primarily clustered around West Africa, East Africa, South Asia, and Southeast Asia. I think a lot, the capacities in all these countries, this is one of the challenges that we face, is that the capacities in all these countries is quite different. In some countries, for example, Pakistan, India, Vietnam, Kenya, there are laboratories that can detect antibacterial resistance. And some of the laboratories, especially in India, are quite capable and quite good. But when you get to countries in West Africa, for example, you'll be lucky if you have one laboratory in the entire country that knows how to do a broth microdilution test. So these are some of the challenges that we face, and it's going to be quite difficult to be able to get all the countries up to speed within 5 years, but it certainly will be able to make some progress, we hope. The landscape is, as I mentioned, this is a whole U.S. government program through the Department of Health and Human Services, through the Department of State, USAID, Department of Defense, and even the Department of Agriculture. So this is not just a CDC event, a CDC program. It touches many parts of the United States government. And I think maybe one thing to think about is how can a group like this help to partner. I think that there are a lot of different areas. I think it's importantly, how can we share information and how can we share solutions around some of the problems that we face. I think especially where we have co-interests around some of these problems and some of the solutions, it would be great to hear some of your thoughts about how we can both contribute to some of the solutions to these problems.